This is Renee Wellman, and today we are going to be discussing communication skills for a healthcare worker. By the end of the lesson, you should be able to list the three main elements of the communication process, identify 4 factors that can interfere with the communication process, identify the 5 C's of communication, describe the role that verbal communication skills play in the workplace, and identify potential communication challenges when interacting with patients. Of course, communicating effectively with others is important. It's not only important in the workforce, but also in your personal lives. The healthcare worker must be able to relate to patients, family, coworkers, and other professionals. A healthcare clinician must be able to easily talk with not only the coworkers and other healthcare professionals, but also with patients and families. So you need to be able to use terms that patients and family can understand. And once someone understands the communication skills, it will better assist them in trying to relate to others effectively and to communicate effectively with others. The communication process involves 3 essential elements. First, there is the sender, who is the individual who creates a message to convey information or an idea to another person. You, of course, have the message, which is the information, ideas, or the thoughts. And the receiver is the individual who receives a message from the sender. All 3 of these elements are important, and all 3 are needed in order for communication to occur. There are many important factors of effective communication. We're going to discuss each one individually, but first, this is what they are. 1 is the message must be clear. The sender must deliver the message in a clear and concise manner, and the receiver must be able to hear and receive the message, and interruptions or distractions must be avoided or limited as much as possible. So the message must be clear. The message must be in terms that both the sender and receiver can understand. Healthcare workers have terminology that they use frequently and many times is not understood by those and not in the healthcare field. So healthcare workers have their own medical terminology and many times the layperson is not able to understand them. So it's okay if you use the healthcare terminology or the medical terminology, but then you need to describe you need to tell them the definition of what that medical terminology is. The terms must be modified, defined, or substituted with different words when messages are conveyed to others. So an example would be a healthcare worker needs a urine specimen. So they would say to the patient, some can be told to urinate in a container, and some patients would understand that, but others you may need to tell them to pee or do number 1 in the cup. Working as an occupational therapist, I talk to many of my patients about urinary incontinence, and if I ask my patients, do you have any urinary incontinence, almost always the question was no, or the answer was no, probably because they did not understand what it meant. So many times I would ask questions such as, are you able to make it to the bathroom on time? Do you have to rush or hurry to get to the bathroom? Do you leak or dribble urine? Are your undergarments wet when you get to the bathroom? And many times I would have to ask the question 3 or 4 different ways in order to make sure that my patient understood exactly what I was asking of them to get the correct answer. It requires constant practice and experience to learn to create a message that can be clearly understood. When I first started working as an OT, I would ask them about urinary incontinence, and I quickly learned that I had to go further than just asking them that. I had to find other questions to ask them in order for them to understand what I was asking. The sender must deliver the message in a clear and concise manner. You must be able to pronounce the words correctly and the use of good grammar is essential. You want to avoid using slang words or words with double meanings. Many times if someone is in their 20s or 30s and they use a slang word, somebody who is elderly in their 70s or 80s will not understand what that slang term means. And you want to avoid meaningless terms such as, you know, all that stuff, and okay, which distracts from the message. If you ever talk to someone who says frequently or okay, it can be very distracting. You don't always remember what they're trying to tell you. Your tone and pitch of your voice is also important. You want to make sure you use a moderate level. You don't want to talk too soft, or you don't want to talk too loud. So you want to make sure it's a moderate level, one that they can hear. Sometimes you have to ask them, you know, you tell them if I'm talking too loud, if I'm talking too quietly, let me know so I can accommodate you. You want to make sure you use a good inflection to avoid a monotone. If you've ever listened to a lecture and someone talked in the same monotone the same whole time, you tend to get very sleepy. So of course you don't want to do that with your patients. For written messages, of course, you need to use good spelling, and they should contain correct grammar and punctuation. And you also want it to be concise. I found when I gave my patients home exercise programs, the less words I used to describe how to do the exercise, the easier it was for my patients to understand how to do the exercise correctly. The proper rate or speed is also important. If a message is delivered too quickly in a rushed manner, the receiver may not have enough time to hear all parts of the message. I just recently took my daughter to the doctor's, and the doctor actually talked quite quickly, and there were a few times I had to ask him to repeat what was said so that I could process everything that he was saying to us. And of course, if you're too slow, it can be very boring to the receiver, and again, the receiver may not listen to everything that is being said. Go ahead and take a minute and restate the following statement so that is clear and concise. Go to the John and take a leak in this cup. If you want, you can go ahead and pause the lesson and think about or write down how you would say that in better terms for a patient. So a good way to say it is, please go to the bathroom and urinate into this cup. And again, if the patient doesn't understand what urinate means, then you would ask them to pee into this cup. The receiver must be able to hear and to receive the message. Patients under heavy medication or are very weak may nod their head as if the message was heard, but more than likely they are not receiving the information, or they may not hear it, and they may also not be able to interpret it or understand it because of their physical state, or they probably also won't remember it. I remember going in to see a patient shortly after they had surgery. The patient was sleeping. I introduced myself, and the patient woke up and said hi. I would ask a question, the patient would answer, and immediately start snoring again. I would ask another question, the patient would answer, and immediately start snoring again. So he basically slept through the whole evaluation, and I would look to his family members to see if he was answering the questions correctly, and he was. But of course, when I went back to see him the second time, he did not remember that I had been in to see him earlier. And of course, during that first visit, I didn't do any education with him, as he would not have remembered anything I had said. Examples, people who may not be able to receive messages, of course, have patients with hearing or visual impairments. And we'll discuss that more later on in the lesson. And patients with limited English speaking abilities would have some troubles also. Ways to make sure the receiver understands the message is repeat the message, and that just, you could repeat it exactly how it was said earlier, or you could repeat it using different words, which is changing the form of the message. And you may also have to get others to interpret or to clarify the message for you. If your patient's not able to understand you, you may be able to look to a family member who is there to help interpret what you are saying so that the patient does understand what you're trying to tell them. The receiver must be able to understand the message. So you want to avoid using unfamiliar terminology like we discussed earlier with the medical terminology. Of course, this can cause a break in the communication because the receiver would not understand what you're trying to tell them. Many people do not admit that they do not understand the terms because they think others will think they are dumb. So if you tell a patient something and you just ask them, do you understand what I'm saying? They will more than likely say yes because they don't want to admit that they don't understand what is being said. So instead you want to ask them to repeat what you said or ask them an open-ended question so they're able to answer it, and so you can make sure that they do understand what you're saying. Of course, ask questions or repeat the information in different terms so they do understand. So restate the following statement in terms the patient and family will understand. Your husband has right hemiparesis and dysphagia as a result of his CVA. So go ahead and take a minute if you want to. You can pause the video and either think about how you would say that to this wife, or you can write down what you would say. So in layman terms, and so the wife would understand, you could say your husband has weakness on his right side and has difficulty talking and understanding language as a result of his stroke. And that would be in terms that the wife would understand what you're saying to her. Interruptions or distractions must be avoided. They can interfere with communication. Talking with others while answering the phone or writing can decrease the effectiveness of the spoken communication. So let's say if you're working at the desk and someone is trying to talk to you, and then while they're in the middle of their sentence, you answer their phone. That's going to, of course, decrease your effectiveness of your communication, not only with the person who is standing at the window with you, but also the person on the phone. Loud noises and distractions in the form of bright lights or uncomfortable temperature can interrupt communications also. If you've ever sat in a classroom that's really cold or really hot, it's at times hard to listen to what your teacher is saying because you're thinking about how cold or hot you are. So examples of distractions would be a child jumping around or climbing up and down off a mother's lap will distract a mother as she is getting instructions from the healthcare worker because, of course, she is thinking about her child more than what the healthcare worker is saying. And then loud television or radio also interferes with verbal messages because the receiver may pay attention to the radio or the television than to a person speaking. Many times when I would go see a patient, either in the hospital room or in their home, their TV would often be on. Of course, I would not turn off the TV without asking them. Many times I did ask to turn the TV off, and so that they could better listen to what I'm saying and that they're not distracted by the TV. And the TV doesn't only distract them, but it also distracts me from trying to communicate with the patient. So you just want to make sure you do ask, and it's also even better to turn it off than just to mute it because patients can still be distracted by what's going on the TV even though they cannot hear it. So it's important to eliminate or limit distractions if meaningful communication is to take place. So if you've ever asked your parents a question while they're looking at their phone and they just answer you without really thinking, you know how phones can distract us. So a review of what we just talked about. What are the 4 important elements of effective communication? Again, if you want to pause the lesson, you can either write down what the 4 important elements are, or you can think about them. So again, the 4 important elements are: 1, the message must be clear. The sender must deliver the message in a clear and concise manner. The receiver must be able to hear and receive the message. And interruptions or distractions must be avoided. So what are the 3 elements are needed? What 3 elements are needed for communication to occur? Again, if you want to pause the video and think about what these are, you can do that. The 3 elements are needed is you must have the sender, the message, and the receiver in order for communication to occur effectively. So just some interesting information for you. Several studies have shown that 20 minutes is about the maximum amount of time listeners can stay attentive. So after 20 minutes, the listener's attention levels begin to drop. Speaking is more stimulating than listening, so your listener may be having a hard time staying focused, especially after 20 minutes. So you want to remember that, and when you're instructing or educating your patients, that you want to keep it 20 minutes or less. Any longer than 20 minutes, they're going to have a hard time listening and retaining the information that you're giving them. So, of course, communication is the exchange of information, thoughts, ideas, and feelings. And there's 3 ways that it occurs. There's verbal or spoken words, there's written communications, and there's nonverbal behaviors such as facial expressions, body language, and touch. So today we are focusing more on the verbal and the spoken words, and we will talk about written communication, nonverbal behavior in future lessons. So like we talked about earlier, healthcare workers spend time talking with coworkers, supervisors, managers, patients, and patients' families. It's a good to organize and plan your thoughts is a critical part of verbal communication. You want to think about who will receive the message. So who are you talking to? Are you talking to another healthcare professional who knows medical terminology, or are you talking to patients and their family who may or may not know what the medical terminology means? And what message do you want to convey when you're talking to the person? So some methods to ensure clear communication is you want to make notes before a phone call. It's a good thing to do this, and then you can make sure you tell them everything that you needed to tell them and you won't forget something. If you're leading a meeting, it's a good thing to have an agenda to follow. And research information you wish to give to someone in advance. So let's say you're going to talk to a patient about a new treatment. You just don't want to give the patients the name of the new treatment and that's it, because they will have further questions for you. You want to make sure you research the treatment and have more information about the treatment so that you can answer the questions that your patients have or that they ask you. But of course, if you don't know the answer, it's always best to tell them that you don't know the answer and you will look into it and get back with them later. 5 C's of communication. Pat Croce, who is a motivational speaker and an entrepreneur, has come up with these 5 C's of communication, and they overlap with the other elements of communication. So, of course, one is being clear, concise, consistent, credible, and courteous. So when you're thinking about communicating, you want to think of these 5 C's to make sure that you're clear, concise, consistent, credible, and courteous. So, of course, clear. We spoke on this a little bit already, but you want to speak in black and white terms and allow questions to ensure that you are understood. You want to make sure that the message you are conveying is clearly understood by the receiver. Concise. You don't want to ramble and get to the point. Have you ever listened to somebody telling a story and it seems to go on and on and on, and as they keep going on and on, your mind starts to ramble. So you want to make sure you get to the point so that they listen to you and know what your point is. Your important message can be lost in non-essential information you include. You want to make sure you're consistent. Your message should be consistent at all times. Report findings in a consistent, accurate manner. Don't change your story. So if you're going to see a patient and you document your observations that you see, when you give your verbal report of your observations, you want to make sure it's the same as what you wrote down as your written report. So, or if you give a verbal report of your observations to 2 different people, you want to make sure that they are the same. Your observations are the same for both people that you report to. Don't change your observations. You want to make sure you're credible. You want to make sure your words should be sincere. Make your message real. and mean what you say. Your patients and other people will know that you don't mean what you say. So you want to make sure you give meaning to your words. Don't heap praise on someone to win brownie points. So again, if you want to praise somebody, make sure you mean what you say. You want to make sure you're courteous. You want to use words such as excuse me, thank you, hello, please, and I'm sorry. These are all important words to use on a regular daily basis. This helps you to set the right tone and attitude. It's definitely mandatory and needed in the workplace, and it demonstrates respect. You want to make sure you talk to people in a respectful manner. It doesn't matter whether you respect the person or not, you still need to demonstrate respect to them. And just some information for you. To comply with HIPAA regulations, you should not call the patients by their full names in the reception area. In the interest of confidentiality, use their first or their last name only. So if you're calling someone in a public area, you want to make sure you use their last name or their first name, but do not use both. There's many challenges that can affect your verbal communication. We're going to just go over some of them today. Of course, a challenge is anything that interferes with communication can lead to a misinterpretation of your message. There are various factors that can interfere specifically with your ability to communicate verbally with your patients. Stereotypes can be a challenge, aphasia, hearing impaired patients, visually impaired patients, severe mental illness, distressed patients, and sarcasm are all challenges to verbal communication. So sarcasm is really helpful. That is obviously a sarcastic statement, as sarcasm is not helpful, especially in the medical field. So sarcasm is using words that mean the opposite of what a person feels to express frustration or an attempt to be funny. It must be avoided, definitely with the patients and coworkers. Sarcasm adds a biting edge to words and can be hurtful or misunderstood. So be really careful of your sarcasm. I tend to be a sarcastic person, so that is something I have to make sure I curb when I'm working. Stereotypes. Stereotypes are formed when you judge all people with a similar trait to be the same. It's not fair to assume all elderly patients are senile or losing their memory, or that all elderly patients are hard of hearing, or that they all get up early, or they all have blue hair. So don't stereotype your elderly patients. But make sure you treat each patient as an individual and approach each interaction with an open mind. Stereotypes may affect how you communicate with a person if you let them. And all patients deserve the best care, no matter who they are. So stereotypes actually go both ways. You may have stereotypes regarding your patients according to maybe what insurance they have, what skin color they have, what their job may or may not be. And then also our patients have stereotypes regarding healthcare workers. So some may think that nurses should be females, or they may think that the doctors are the know-all, or doctors should be men. So our patients also have stereotypes towards us, and they may also have stereotypes towards us again regarding our skin color or our religion. So stereotypes go both ways, and they can affect communication. So you need to make sure that you don't stereotype your patients. Patients with aphasia. Aphasia is a collection of language disorders that are caused by brain damage, and it's mostly caused by stroke. Symptoms differ from patient to patient, and it can range from having trouble finding the right word to use to losing the ability to read, write, and speak altogether. It does not affect a person's intelligence, though, and patience is essential when working with these individuals. You want to make sure you allow them to speak. So when talking to someone who has aphasia, someone who has trouble finding their words, you want to make sure you give them time to answer you. You don't want to rush these patients. You want to make sure you have extra time to spend with them. I had a patient who had aphasia, and any question I would ask, she would automatically answer yes. And then I had to make sure I waited longer and then she would answer again, either with yes or no, and that would be the correct answer. So it's just really important to give them time. Also, you could ask them to point to an area so they're having trouble finding. If you ask a patient, where do you have pain, and they're not able to verbalize it, then go ahead and can you point to where you're having pain, and they can point to that area. And I have a video here of a patient who has aphasia for you to watch.
What do you find most difficult about talking? Well, just talk to you. I've worked in my house for all my life. All my next was working home. As far as 10 minutes back in the gate bank. Oh, the first one was no trouble. 10 minutes walk around, You see, my dad died, my last marriage. So that was what I was going to do. So I hurried on it up. And with my legs and a job, different jobs and all the rest of it. And that was my life. I know it's silly for people, but that was my life. And I worked on farms, dozens of cars, farms. And fortunately, I knew it. I loved it. I really, honestly, on all the farms, dozens and miles and miles I did for it. Some of them in the middle of nowhere. Look at the inside. You thought it didn't seem to me that. What I know, what all people I know, it'll be getting better than you. But I was getting a bit mess of myself really, and it gradually got better. And everybody is with me. Even when in Darlington, they're all girls, all like yourself. They are honestly, yeah. Definitely, yeah. Some of them boys never going to be right. It's one of those things, you think, it's never going to be. Christmas time, they all took me to then different places, yeah. What I would have done without them, I would have known. I don't know what the hell I would have done. I think the reason was when my mum, she had a house. No, we had a home, but mother, she sort of worked jobs. It's it, and now I'm beginning to get mixed up with it. But I suppose that's life. Life is, And whatever I say, do myself. Now I've got to the bone, sort of thing, and I'm okay now. I don't mind it now.
So Henry is a good example of aphasia. You could see how he had trouble finding his words. Sometimes they were jumbled. And you can also see how frustrating that can be. So very frustrating when you know what you want to say, but you can't say it or you can't find the words. So it's just really important to have a lot of patience with these individuals and take your time with them. So here are some communication boards that some patients may use. The different picture boards, the patients can point to what they want or what they're feeling or what they need. And then the pink board is a boogie board, and I've used this with a couple of my patients. When patients have lost their hearing later in life, many times they're not able to read lips, or they do not know sign language. So a boogie board is nice in that the clinician can write down everything they want to say on the boogie board, and then the patient is able to verbally respond. So if that's the case, you need to make sure you plan extra time with that patient, because it will take longer, because you can only write 1 or 2 questions at a time on the boogie boards so that you don't overwhelm them. And then also a small dry erase board is also helpful for somebody who is not able to hear and cannot read lips. And I've done that also with a patient, is to use a dry erase board to communicate with them. And also paper and pencil if you need to do that. So if your patient is not able to hear, you need to make sure you plan extra time with them. So again, the hearing impaired patients present special challenges. If you have the opportunity, or if you're able to learn American Sign Language, that would be very valuable and very helpful for you in your healthcare career. Many deaf people can read lips, so that is helpful. So if they are able to read lips, you want to make sure you speak slowly. And of course, you need to face the patient head on so that they can see your lips in order to read your lips. Many patients might be accompanied by an ASL interpreter. And if that's the case, your conversation is still with the patient and not with the interpreter. You want to make sure you look at the patient and speak to the patient, because they're the ones who you're working with, and they are your patient. Again, you want to speak in a normal tone of voice, slowly and clearly. You don't want to talk louder. That's not going to help them hear you anymore, so just speak in a normal tone of voice. Visually impaired patients, verbal communication is the main form of communication for them. When you go out to a reception area to see your visually impaired patient, you want to introduce yourself and make sure you address the patient. Once you address the patient, then they know you are talking to them. If the patient is standing, you can guide them to a chair by placing their hand on the chair to show them where their chair is at. And also ask the patient what assistance is needed. Don't assume that they need help. And this is the case with any patient who has impairments. Always ask what they need help with. Ask or tell them, if you want me to help you with something, just let me know and I'll be more than happy to help you. But don't assume that they need help with everything, because more than likely they don't. Of course, you want to make sure that you include the patient in the medical plans. Remember, they can still hear and they understand what is being said. They just can't see you. And inform the patient what you're doing. So if you're going to give the patient a shot, you're just going to say, hey, I'm getting the shot ready for you. And now I'm going to clean your arm. It's going to feel cold and wet. And now here's the shot. I'm going to give you the shot in a count of 3. Or taking their blood pressure, you're just going to say, okay, I need to put the blood pressure cuff on you, and you're going to feel the cold stethoscope on your crook of your elbow. So make sure you tell them what you're doing so they know what you're doing and you don't scare them. They may also have a service animal with them, and if they do, you need to remember that the service animal is not a pet, and they are working, and you should not pet the service animal when they're working. You're more than likely to you can definitely compliment the service animal to the patient, but do not pet them when they're working, because they're there to do a job. Patients with severe mental illness may affect a patient's judgment, making them incompetent or unqualified to make decisions on their own. If this is the case, they're usually accompanied by the legal guardian. Again, even though you have the legal guardian there, it's important to speak to the patient first and then to the guardian. There's times where you could ask the patient a question and let the patient answer, and then look to the guardian, and the guardian may say that their answer is correct or wrong, but you want to always speak to the patient first. When you repeat in the instructions you give to the patient, you also want to check with the guardian to make sure they understand all your instructions as well. So distressed patients. Many patients who come into a healthcare facility are nervous, they're confused, they're scared, they're sick, they may be angry. And so it's make sure that it's important that the healthcare clinician remains calm and speaks in a steady, confident voice. You want to make sure you're sympathetic with the patient. Some of the following sayings can be helpful and can calm a patient. You could say something like, "I'm so sorry you're upset. Let's see if we can make things easier for you." Put yourself in the patient's place and respond with compassion. Sometimes it's helpful to use your judgment, of course, but to lay your hand on their shoulder. Sometimes they need that personal touch. Sit down and get at their level to talk to them. Stay calm and take your time with them. Don't rush through it so that you can help the patient get through their difficult time. Proceed slowly and carefully with the patient so that they know that they care and that you're taking your time with them and just ease their nerves there. So some communication challenges can include, so if you want to take a moment, you can pause and write down some of the communication challenges that we talked about. So communication challenges include sarcasm. Sarcasm is not a good thing to use in the workplace. Stereotypes. You want to make sure that you do not form opinions about people based on their skin color or their religion or what type of insurance that they have. Patients with aphasia. Again, aphasia is those who have difficulty understanding or speaking language or finding their words. Hearing impaired patients. Visually impaired patients, and there are some visually impaired patients who you can give them a very large print font that they would be able to read the large print font, sometimes not. And some visually impaired patients may also have a computer screen at home that they can put written information underneath, and then it projects it in a bigger font for them to read. And then other times that will not work. Patients with severe mental illness may have a guardian with them, and their severe mental illness may affect how they make decisions. Distressed patients, when patients come in to see us, they may be scared, they may be worried, they may be upset or emotional. Let's make sure it's important that healthcare clinicians take their time with them to ease them. So after class today, this is your take-home assignment to do. After having a conversation with someone, take some notes on what was good about the conversation and what was not so good. So good points can include, did the other person make good eye contact with you? Did they use a good tone of voice? Did they use a good speed of conversation? Were they clear, concise? Was the volume okay? Was it too loud? Was it too soft? Some not good, or I guess the volume would be a not so good points if it was too loud or too soft or quiet. Were they distracted by the phone or TV? Did they ramble? And then we will discuss your findings during a Zoom meeting tomorrow. So you just take a few notes on the conversation and what was good about the conversation and what was not so good, or what were some of the challenges that you found you had during the conversation. So we are going to continue talking about communication. We'll talk about communication, including telephone etiquette, public speaking, and meetings tomorrow. And then some other things that we'll talk about with communication at tomorrow, but in the days ahead, are nonverbal communication, and then more on some written communication. So if you have any questions or any concerns, make sure you call me or you can email me if you have any questions about today's lesson, and I will certainly help you. So I hope you all have a great day.